Alright, so here we are with the foot. We're going to go back over a few of the structures that were on the top of the foot that we talked about last time. We talked about this coming down here and attaching to the bone here, the metacarpal here, or metatarsal here. And this, of course, is the fibularis tertius right here. We also talked about this muscle coming down here and going and extending to the digits here. And so this is the extensor digitorum longus. What you'll notice here is that there are these muscles that are coming underneath, going across at an angle, and these muscles underneath are actually the extensor digitorum brevis. Now over here we have another muscle coming down here, and this is the extensor hallucis longus, and right next to it coming across right here is the extensor hallucis brevis. Now if we turn the foot to the side, you'll see that there's a series of muscles right here that actually attach to the toe and literally move the big toe away from the foot. And so this, of course, is the abductor, abductor hallucis. So that's what this is here. If we turn it this way, we can see coming across here we have the abductor digiti minimi coming here. So that would be that, going across like that. Now, if we then turn the foot upside down, you can now see here a tendon coming up and going to the foot. This is actually the tendon of the flexor hallucis longus right there, and that's what that is. You can see underneath it, going on this side and on this side, that is actually the flexor hallucis brevis right there. You can see here this short muscle coming from here and going all the way down this way. This is actually the flexor digitorum brevis, whereas the flexor digitorum longus, the tendons are actually underneath the flexor digitorum brevis. So literally they would be just underneath and they would all go to the toes. You can see here this set of muscles going to the digit. This would of course be the flexor digiti minimi, which is what that is right there. And then if we were to go deep to this, we would actually be able to see, you can actually see kind of these little pink structures here, which would then be like the lumbricals, which is what these are right there. And then if we were to go deep to this, we would actually be able to see the adductor hallucis, adductor hallucis, both the transverse head that would go across here and the oblique head, which would go across like that. And then deep to that, we would then be able to see the interossei, which would be the plantar interossei on this side, and then the dorsal interossei, which would be deep to these on this side. Now we're done with the foot. We need to talk about the blood vessels and the nerves.